Good evening and good to have you with us on this edition of the Urban Debate. For the next 1 hour, viewers, we are going to get you some interesting data on COVID infection in our country. We're going to break it down into states and your cities and have a conversation about whether we are on the cusp of a turnaround. Is India almost out of the woods, seeing a peak in its cases? Of course, none of this will mean that we can put our guard down, especially not with the festival season around the corner. But it could mean that all of the steps that we've taken, all of the hard work so far and the sacrifices are beginning to yield results. The Times Protiviti India Outbreak Report, for the first time since we began this exercise over 3 months ago, is painting a relatively optimistic picture. For the first time, the number of cases being registered on an average has shown a sharp fall in our own data analysis. Now, some states seem to be doing much better than the others, but there are some growing trends about smaller cities and towns, and outside the big metros, cases now beginning to rise. I'm going to get you all of this in the next 1 hour as our experts also help us decode this. First up, the overall national picture. The reproduction infection rate, which is what the experts call R0, has now come down to 1.5 from 1.63. That's an encouraging statistic. The mortality rate, as the government has also highlighted, has come down to 1.9%, projected to gradually in the coming weeks drop to 1.7% from 2.26, an encouraging statistic. India is likely to see its peak, projected to see its peak in the first week of September. And same goes for most of the big states. The recovery rate is showing a significant improvement. We've hit 70% now. Our 10 days average of recovery rate has hit 70%. But let's get into some more interesting details, the key highlights and takeaways of all the number crunching that our expert team has done. Here are some of those highlights. We'll give you more as we progress along the show. India is likely to reach its peak in the first week of September. The infection rate is slowing down. Major states are projected to see their peak between September 1st and 15th. In terms of areas and cities and districts, Nasik, Raigad, Palghar, in focus, in the spotlight, in Maharashtra, are continuing to show an upward trend. So that's not good. Thiruvananthapuram, Jaipur, Indore, still showing an upward trend. That's not good. Bhopal, Havra and Jaipur have less than 3,000 active cases. In terms of cities of that size, they have still got less than 3,000 active cases. In terms of states, what is troublesome and a concern are states like Karnataka, states like Bihar and Andhra Pradesh, whose doubling time is still 12 to 14 days. They're taking just 12 to 14 days still to see a doubling in the number of cases. Maharashtra, Kerala and Uttar Pradesh have seen an improvement, and at least now the doubling time has gone up to 15 days as a moving average. Haryana is the only state, viewers, only state in our country that has less than 10,000 active cases. Maharashtra is still a big concern. Even though Mumbai and Thane have shown an improvement, Maharashtra still accounts for 24% of the active cases in our country. The growth rate in Maharashtra, though, has come down from the 3% where it was earlier. The growth rate for Telangana and Tamil Nadu has also come down to below 3%. Growth rate for Gujarat, for West Bengal, for Delhi and Madhya Pradesh has also come down to below 3%. So these are good, encouraging statistics. Andhra Pradesh and Odisha have the highest growth rate currently of 7 to 10%. Andhra Pradesh and Odisha also have a doubling time of just 6 to 7 days. So we need to keep an eye out for what's happening in these states. Now, gradually, I'm going to take you through more and more details. But let's say good evening To our panelists who are joining us this evening, Dr. Sanjeev Singh Yadav, Secretary of IMA in Telangana, Dr. Abhay Shukla, National Co-Convener of the Jan Swasthya Abhiyan, joins us this evening. Dr. Rakesh Kapoor, Medical Director for Medanta, Lucknow. Dr. Girdhar Babu, Professor and Head for Life Course Epidemiology at the Indian Institute of Public Health, joining us from Bengaluru this evening. We'll also have Dr. Swaminathan join us shortly. But first up, let me go across to Dr. S.K. Sarin, Director for Institute of Liver and Biliary Sciences. Dr. Sarin, good evening. Thank you so much for joining us this evening. Let's begin with the larger picture. There is so much that constantly gets written, Dr. Sarin, about the number of cases that India is registering every day, how they have become the highest in the world. Other countries are showing an improvement. But a deeper analysis shows an improvement in recovery rate, a fall in mortality rate, and some of the worst hit states now showing some improvement. What is your own sense of these numbers and where we stand today?
Thank you, Tanvi. And that's an amazing data that you showed. And looks like a statistician or an epidemiologist is presenting the data. I want to draw 3-4 things to people's notice and your own and policymakers. When you say that R naught has come to 1.55 from 1.67, what does it mean? It means one person is still infecting 1.5 persons. Therefore, we have a long way to go. To show a decline, we have to have first R naught as 1 equal to 1. One person is equal to infecting one person only. Then the curve is flat. Then you are in a plateau. The decline will only start when R naught is 0.75, 0.5, 0.25, the way the Australia and New Zealand achieved. So if one person is only infecting half, but let's say 10 people are infecting 5, then you will see a decline. So right now, I wouldn't be too happy and accept it that yes, India will peak out. And secondly, importantly, peak doesn't mean the end of the epidemic. Peak only means that you're not rising, but 1.55, the data means we are still on the ascent. Well, some parts of the country like Delhi or others might have shown a plateau and maybe decline. Delhi has gone to an R naught of maybe 0.6 now, which is much better. So when you look at the overall picture in the country, I wouldn't be say that we are comfortable, and in no way we should be, hanging our boots and say, okay, we have done enough. Number 3, we also must realize these numbers are only based now on rapid antigen test. So there would be many people who would not probably be diagnosed or misdiagnosed or missed and are asymptomatic. So all this, and I did study in last few minutes, your report, it is based on a SEER model. The SEER model is susceptible, exposed, infected, and recovered. We published and we projected for Delhi. Early in March, the SEER model that Delhi would have end of July, beginning of August, the peak can come down. But it has come down, but still there are numbers. So your SEER model, this report mentions September as the time that you will have a peak and decline. I wish it is true that there is a decline after that, but it's a long way to go. Now, the one part which is missing in these models is the antibody test, like Pune. Pune has 50% of the people who have been exposed. Means half of Pune's population. Delhi is 29%. 1 in 3 in Delhi was exposed, but was never picked up. So these silent exposures of people make us see that they have been exposed, they never got symptoms, they were latent, and they made antibodies. And this gradually will have to go up till the time you have a large number. And you all know the data, 70 to 80% of the people. My gut feeling is every month we will be adding 7 to 8% of those exposed in Delhi and maybe many parts. So you will need few more months before your population is more exposed, have been exposed without symptoms. I don't want them to be sick. And they have developed antibodies, then only you will be safe. So these data and the different trends, they are only showing differences in the way we detect, differences in the way our testing is, and who all are we testing. So all these will say that our data looks good, the modelings look good, but the reality is India is still at a very high number, third in the world in the number of infected people. Mortality has come down, but it should come down to less than 1%, maybe 0.5%, 0.6%. Then only we will say yes. So we have a long way. The other limitation of such modeling and such studies is when we had lockdown, what lockdown did was it delayed the peak, let's say by about 67 days. When you have social distancing, you just delay by 4%. Right. When you have social distancing, lockdown, all those measures which you have, you delay the peak. So every state, every small city and district, how they have looked after their area will decide upon the delay in the peak. And the delay in the peak will also depend on the population movement. If people are coming, people are going out, we have a huge problem. So India specifically is like multiple small countries, has to be extremely careful. There has to be a quarantine policy for every single state, every single district. Then only you can contain this. And of course, the number of people to be tested had, in my mind, at least to be increased 10 times more in every small part of the city. So I still, when you ask me the overall picture, I would say we are still on the ascent. We haven't peaked, we haven't plateaued, and maybe next few weeks, we have to struggle very hard to contain it.
Okay, I take your point. In fact, let me also tell our viewers who've not followed our India outbreak reports in the past, the methodology actually includes an analysis of an exhaustive number of states, over a dozen states. We were initially looking at simply the bigger cities because that's where the concentration of the cases was in the initial months. But since, like Dr. Sarin was also pointing out, since the travel began, movement of people began, we've now beginning to see cases emerge in other smaller cities as well, outside of the metros, and those have also been included. So today we are actually also going to talk about a little bit about Madurai. We'll talk a little bit about Patna, even East Godavari, and how these places are actually doing and what's the big challenge there. The models are actually based on the percentage-based model, a hybrid time series model, and the SEER model. That's actually usually the most talked about, in our country. And we've then taken a most likely scenario or as an average of these three models. Of course, the infection rate varies from a state to state. But let me go across to Dr. Rakesh Kapoor and ask him, Dr. Rakesh Kapoor, do you concur with what Dr. Saran is saying? Are we close to the point where we'll peak, and if we are careful and if we are disciplined, then perhaps within a month we begin to see a turnaround?
Yes, definitely what Dr. Sarin talked about in a very scientific way, that we have to understand what he talked about, like one person infecting one person, or the mortality rate which we are talking about, unless until we are aware of the situation. See, if we have to control the coronavirus, we cannot only bank upon what the government is doing for us. Each and every individual of the society has to take care of himself, has to take care of the neighbors and all that. Like he talked about, there are so many asymptomatic carriers who gets infected and probably they are symptomless. So the disease is over after, say, 8 or 10 days. But of course, these people are the person who can infect others. They can infect the persons at home. So we have to be very careful. Like before coming here for this debate, on the way when I was coming, believe me, 80% people are not wearing masks. There was no social distancing, what I am saying. And these are the people who are infecting the others. If you see in the hospitals today, I don't have the real statistics about that, but if you see the doctors, if you see the others, those who are working in the CCM, critical care units, ICU, they are not infected because they are wearing all the PP kits, they are taking all the precautions. Most of the even nurses, paramedical staffs, people in the hospitals and all that, most of the time they are getting infected at home. Even if you see the doctors who are not taking care in their practice, in their outdoor practices, or by the housemates. Like previously I was a director of Sanjay Gandhi Institute, still I am staying there. A household servant was actually working at 9 places she was visiting, and believe all the 9 houses were corona positive. So we have to understand difficult time is there, but till we understand whatever is talked about, social distancing, wearing the mask, and you have to keep a distance, social distance. If you have symptoms, get tested or quarantine yourself at home. If you have people like your parents at home, small children at home, I know it is very difficult to isolate yourself, but we all have to follow that. Only then statistics, what Dr. Sareen talked about, the mortality rate should come down. Even if you see in Bombay, at one time, we were all blaming the Dharavi area and all that. But still, now the statistics which you have provided, in Dharavi, the incidence has come down. It is now mostly in the societies and all that where household servants are coming, people are not taking proper care. So what I believe, what Dr. Sareen talked about is very pertinent. We all have to understand that only we can save ourselves. The God cannot save you. Even the government can make policies, but government cannot save you. We as an individual, we have to take care of ourselves, of the society, of your neighbor, your state, city, and the country.
With you. In fact, we cannot emphasize on this enough. We repeatedly do it here on Mirror Now. Remind our viewers that the responsibility is also ours. It may seem like COVID's gone, but it's still very much out there. The infection is right around the corner, and we cannot let our guard down. Repeatedly, we've highlighted examples of cities and towns and areas within cities where the minute people have let their guard down, started coming out, forgotten about social distancing, not worn their masks, attended big gatherings, that's the time the city and it has seen a turnaround and gone downhill. But the fact that as of August 1st, we were looking at about net new cases of 16,000 per day, but now the analysis shows the net new cases of 10,000 per day. Could be heartening, because before that gradually we had seen a rise from 1,000 to 4,500 per day to 7,000 per day, and this is the first time we are actually seeing some amount of slowing down. But let's not put our guard down. Very quickly, before I thank Dr. Sarin for joining us, because he has to leave early. Dr. Sarin, the point that you raised about sero surveys, how should people be reading those? Because now on a daily basis, one or the other state or the city is releasing its own sero survey analysis, whether the population in certain parts has antibodies, 30% of the population to 50% of the population. How do we read this data? Does it mean that we are moving towards herd immunity?
2-3 things. One, what Dr. Rakesh said, that people who are in the ICUs or critical care are less infected. I'll give you exact data at the Institute of Liver and Biliary Sciences, ILBS. The staff and the doctors, antibody positivity is just 9% compared to what you have in general Delhi, when it was done was about 23%. So people who are cautious, whether doctors, nurses, staff, technician, or a common citizen, you will not get infected. Although this is one situation where you want to get infected, get the antibody without suffering, but that's not a good idea. You may get into trouble. What I want to say, that when somebody is calling, somebody is eating, somebody is sitting around chatting, please never take out your mask. This is the commonest cause of having. So both community and the individual common man has to understand the responsibility has to be shared. Now, as far as interpretation of sero survey data, the country is using the COVID Kavach, which is developed by ICMR, validated by them, and it is a hemolysated. This antibody is a very broad antibody. This has to be validated by multiple other antibody tests. But if a city is having 50% positivity, I think there should not be any new cases. There are not, should be less than 1. And we therefore, when you say Pune is having a rise, but have a 50% population, one of the two data has to be rechecked. It cannot have 50% and is still on the ascent. It should plateau out by 50%. When you have 75% of the population positive, certainly there has to be a R naught which can be close to 0.75 or zero point 0.5. I therefore mean, if zero surveys are correct, very carefully done, month after month in different cities or towns or states, and we have a very validated data, I think country can make policies. It should be able to guide us. When should a given city, when should a given state, when given locality, you can go down to that level of accuracy based on zero surveys if the right kit, right test in a right sample collected on several occasions has been studied. I would therefore say zero surveys are important, but of course, it doesn't give you immunity forever. We do not know, a second wave can come anytime. Thank you.
Yes, thank you so much for elaborating on that, Dr. Sarin. Good to have you with us. I want to now quickly talk a little bit about Maharashtra. It's been a key focus, a state that's been constantly on top of the table since the pandemic hit us. And even now, even as the big cities of Mumbai and Thane are beginning to see some improvement, Pune is not completely out of the woods, the fact that the festival season is around the corner means that we have to be extra careful. But if you see the chart and the graph for Maharashtra for recovered versus the active cases, you will see now a gradual gap increasing between the recovery cases and the active cases going further down. So that gap is increasing, which is a good sign. We need to see if this goes on for a longer time. For our projection says that Maharashtra is likely to see its peak by mid-September. So we are hoping that the Maharashtra sees its peak of cases by mid-September, and after that there is a turnaround. End date as of now is projected to be around 18th of November, but it really depends on how we handle our cities and if we reach this end point on 18th of November. Mortality rate continues to be a concern for Maharashtra. 3.2% is more than double of what we are looking at in this country. And that's a concern. A little less than double. And that is a concern for Maharashtra. Dr. Abhay Shukla is with me. Dr. Shukla, let's begin with your views about how Maharashtra has been faring. What is it that we need to watch out for?
Yeah, thanks, Tanvi. And it was good to hear about the projections from your end. And I remember in a previous program where I had spoken also, you had made presented some projections. I can see that you have revised the projections, which is that is positive. But I would just like to point out that based on a digital twin model, which has been used in the context of Pune, and Pune is now the second big epicenter of the COVID epidemic in Maharashtra. Pune has surpassed Mumbai in the number of cumulative cases of COVID-19. It has 137,000 cases, more than even Mumbai, and about 40,000 active cases. So I would say the projections for Pune are not as optimistic based on the digital twin model, which a public health group has, actually used in the context of Pune, and led by an organization called Prayas. And here we see, and these figures are quite reliable because we have been comparing them on the basis of, what was projected earlier and what was actually emerged. So today we see that in Pune city, the projection showed that it would be about 500 to 550 patients requiring ventilator beds. And if you go to the dashboard today, it is 491 patients on ventilators with COVID-19. So the model is quite robust. Similarly, the total number of cases requiring oxygen beds was projected to be 6,000 and it is actually 5,900 something. So it's quite a robust model. And according to this projection, Pune will continue to have large number of cases. It will not reach its peak till probably mid or end of September, probably end of September. And the reason for that is that there are a series of micro epidemics which are interlinked with each other. So it is the figure of 51.5% seropositivity, which is being quoted, is only for the high prevalence wards within Pune. There are several other wards where the prevalence rates are much lower. And therefore, what happens is that even if some wards have had reached their peak, other wards then start picking up. And then the epidemic continues to propagate. And if a person shifts across wards, then again the infection can get reintroduced. So therefore, there's a series of micro-epidemics which we are looking at, in Pune at least, which will probably lead this epidemic to continue for at least the next nearly 1.5 months at a high level. And only by October, perhaps the situation will start declining. So this is one important point. The other important point is that the importance of testing is also need not be overemphasized, because the models shows that if testing levels are doubled, then the number of cases will significantly reduce, and maybe at least 10% lower number of people will get infected if higher prevalence of testing is actually ensured. Another matter of concern in Maharashtra, I'll first talk about Pune, is the fact that many of the existing public hospitals do not have ICU beds or isolation beds as per requirement. Pune Municipal Corporation, which is the second largest corporation in Maharashtra, all its hospitals, they don't have a single ICU bed as of today. They cannot treat any critical COVID patients. This has this kind of neglect of public health services, and then we are saying that some jumbo hospitals will be set up. By the time they are set up, we would have crossed, perhaps reached the peak, and that would be almost useless at a cost of some 300 crores.
Correct.
So this is another issue which, needs to be actually addressed. Another point about treatment is relating to the newer drugs which are being used, like tocilizumab and remdesivir, that these need to be used according to a particular protocol called the, monitoring of experimental and unregistered, interventions protocol, which has been actually, actually earlier declared by the ICMR also. It is something which is adopted by WHO, but we are not adopting this protocol yet, probably in any state. And therefore, this extremely expensive and new medicine, which is of somewhat, debatable value, is being given on a very large scale. 45,000 doses of these two drugs had been given in Maharashtra by end of July. But we do not have a rigorous monitoring of each patient who is receiving.
In fact, Dr. Shukla, if I may come in there, because you've raised a very important point, and I do want to highlight this to our viewers. The protocol for this COVID drug, and the fact that it's being so widely used to the point that there is a shortage and people are willing to pay an exorbitant amount of price running from pillar to post for this drug, even when there are doubts about its effectiveness and its efficacy. And that's actually a special report that even Mirror Now has done just today, Dr. Shukla, and I'll also be, presenting it to our viewers here on the Urban Debate. I take your point on that. Thank you for highlighting that. But if I may just add a few more things about Maharashtra and tell this to our viewers, that Mumbai has already seen its peak basis the information. Yes, coming back to you on that. Pune and Thane, Pune is struggling a little right now. Thane has also shown an improvement, peaked already. Raigad, Palghar had become a big concern for us. We had rung the alarm bells on this area outside of Mumbai, and there now situation is gradually coming under control. But there are other parts, other cities like Nagpur, which are now showing a rise in cases. Dr. Shukla, is it also that other cities in Maharashtra that's dragging its overall situation down?
Yes, you're correct on that. As I said, it's a series of micro epidemics which are linked with each other. So what happens is the large cities and certain parts of the large cities, they are the first ones to have reached their peak. But even within those large cities like Pune or Mumbai, other regions then later on start picking up. And when we're talking about Maharashtra, a large number of districts are still far from reaching their peak. So they are still going to take at least a month to reach their peak levels. And in that time, transmission will continue. So this kind of perpetuation of the epidemic across the state is something that we are unfortunately likely to see continuing for the next 1 to 1.5 months at least. One more point about Maharashtra, which I'd like to flag, is the making Aadhaar cards compulsory or mandatory for providing remdesivir and tocilizumab, which is something which is going to actually prove a kind of a barrier for people to access the drug. This is something which needs rethinking, and we need to ensure that the MEURI protocol, which has been adopted by WHO and which is also accepted by ICMR, this should be rigorously followed with informed consent, with proper recording of outcomes, and side effects for each patient who receives these experimental drugs. These are experimental drugs which are not yet proven to be fully effective. But yes, we can use them, but only with these rigorous monitoring protocols in place, which yet are not being used across India. And therefore, we do not have any way of actually knowing whether they are
Okay.
really working or not. Yeah. So,
Okay,
yeah, this
thank you
also
so much for that detailed analysis when it comes to Maharashtra. I want to just also bring up now some of the southern states and where they stand today. Tamil Nadu, as per our projections, has seen its peak already, although some of the cities are still in a bit of a problem, and its R0 has come down to 1.41. The mortality rate is also at 1.7%, much lower than the mortality rate that we have here in Maharashtra. The gap between active cases and recovery percentage is also now increasing. That recovery rate versus the active rate, you can see that in the charts. That gap is now increasing, which is also an encouraging sign. Telangana is projected to see its peak by August end or first week of September if they continue with the kind of numbers that they are reporting right now, and there is no change, a sudden change that we see. Often what we see is when states start testing more or testing less, or revealing more data or revealing less data, or let their guard down, these numbers change very quickly, overnight, within a few days, which is why we are constantly tracking it and constantly bringing you these updates, because numbers change and then the pictures also vary. And if you see the recovered rate versus active rate for Telangana, that graph will show you what a roller coaster ride it's been, which means that the authorities need to be very careful and very transparent and diligent about the statistics that they're sharing with us. Though in the last couple of weeks, there has been some stabilizing in terms of the gap between recovery rate and the active rate. I also want to quickly tell you about Kerala, again projected to peak in the first week of September. Kerala had actually gotten a very good hold on this entire situation, but then of course as we opened up our borders and inter-country and intra-country travel began, Kerala saw cases rise again. So hopefully now they are going to see by first week of September a turnaround, and perhaps then they can be on a good strong path to recovery. Let me also tell you the state of Andhra Pradesh. Now Andhra Pradesh is somewhere around its peak as we speak, and it's kind of plateaued there, which is very interesting. Can it go over the hill and then start seeing a fall in the number of cases? That's the big question. There's also some interesting facts about Andhra Pradesh. For example, the mortality rate is less than 1%, far lower than the national average. I don't know what to make of it. The infection rate is also much lower than the national average at about 1.29. But let me bring in the experts who can give us more insights into this. Dr. Girdhar Babu, good evening to you. If you can hear me, your view on what's happening in Telangana and Andhra Pradesh right now.
Yeah, thanks for having me on this show, Tanvi. Based on this data for the entire country, the few observations before I speak about only South India. Now, more and more, what we are seeing is we get these reports of the states which are reporting well, testing well, and pick up these areas as areas of concern. I would not agree with that kind of assessment, for simply the reason is that the states that don't test well, that they do not follow the protocols well, will miss the transmission. Examples being Bihar, which has picked up later, and based on your own analysis, Telangana and West Bengal, which have not reported earlier. So therefore, that's where I bring in Andhra Pradesh. Andhra Pradesh did everything right. Most of the times, Kerala is shown as an example how to do things effectively. But if you ask me, I'll say Andhra Pradesh is the state one has to emulate, because they did not have any protocols before. Once the COVID-19 pandemic hit India, Andhra Pradesh started their protocol development. And it is one of the first states which reported more than 2,000 cases in every district. That's a good sign to show that testing has been implemented very widely and in most systematic way. By systematic, I mean You follow the syndromic approach, test the people who have symptoms, thereby limit the transmission. So the reason, and this has been proved over and over again, the reason when you expand testing, the mortality will come down. Andhra Pradesh state is a testimony. I have complete faith in the kind of estimates we are seeing from Andhra Pradesh, and your model projections also say the same thing. However, I differ in the perception that we will have a peak which is like an inverted V shape. It can't be so for India because, as rightly pointed out by esteemed panelist earlier, there are several micro pockets out there, several areas where transmission has not started, several areas where we have not picked up transmission. Therefore, there will be a plateau for some time in most of the states. And as a result, even at the national level, there will be a plateau for some time. Only so it will be not an inverted V, it will be an inverted U. And the plateau phase of that inverted U will be for some time, for at least a few weeks, if not few months, after which the cases will start tapering down. The final observation I want to make is if you look at the 7-day moving average or the 30-day moving average, there has been a drop in the test positivity for the entire country, and also there has been a drop in mortality. I'm not a great fan of case fatality rates because they bring with several limitations of its own, mostly because there is a lag effect after which the case fatality gets reported. I mostly believe the seroprevalence surveys and thereby looking at infection fatality rates. And by that standard, India is by far one of the lowest, and the entire Southeast Asia has similar lower estimates. So if Andhra Pradesh has less than one case fatality, imagine what the infection fatality rate in Andhra Pradesh is. So we need to emulate such models for the other states.
Okay, let me also bring in, Sanjeev Singh Yadav, Secretary for IMA in Telangana, right there in the middle of all the, activity. Dr. Yadav, your own analysis of where Telangana stands today, and the one thing that I did want to ask you, if there are concerns that this heavy incessant rainfall, the flood-like situation in many parts in our country today, including Telangana, Odisha, if that is going to add to our challenge of the pandemic.
Madam, Telangana, you have to take two sectors into it. One, the sector which is Hyderabad per se and the surrounding districts. Hyderabad per se, the plateau has already come, and now we are slowly gliding down. Rains definitely are creating a havoc, but one way you can say that rains are making people to stay indoor. That is the reason why the transmission can be less. But if it is coming to the districts, the plateau is yet to reach. There are a lot of infective cases in the districts. Most of the hospitals there, which are basically government setups, are almost full. The reason being virulence is very high there. Number two, lack of proper knowledge of how to deal with it is one of the sector where Telangana is presently facing a problem. Definitely more testing in the districts is needed. The government has promised 40,000, but presently they are only doing 20,000 testing. More 20,000 testing, at least 10,000 more will add up to the situation where we can find many positive cases coming in. Although the Hyderabad city proper has come down, but the old city, wherein there are a lot of concentrated public places where the houses are very small, there are a lot of containment zones. Around 21 containment zones are in old city. Their zero testing is very important to find out whether we are coming out of this situation or still something is going to bloat up. The rains are definitely a problem for the districts because a lot of places have been cut down from the main gateway. That is the reason why these testings are slightly less. But all said and done, Hyderabad is definitely coming down, and I hope by September end we will be almost on a zero period.
Okay, but outside of Hyderabad, are there any concern areas that you feel, as far as Telangana is concerned, the numbers keep changing, sudden spike and sudden drop, which many experts also find difficult to understand. Why is that?
Madam, in districts, the infrastructure, as already told by my other colleague regarding Mumbai Municipal Corporation, the basic setup there is small hospitals. There are no big hospitals in the district area. Almost all the districts have a medical college now. That is the reason why the testing has improved. But the thing is, the basic infrastructure of medical care is not that much. The governments which have come earlier and now also, they have not put in around 5% of the GDP into the healthcare. If they do that, maybe our healthcare will improve, and in coming future, we will be able to tackle these things in a much better fashion than we are doing right now. The number is definitely increasing. That is the reason why there was supposed to be a lockdown, and suddenly the lockdown was not implemented, and people from the city moved to the districts. That is the reason why in the districts there are a lot of cases presently coming up.
Okay, the travel is the reason why the cases are coming up outside of Hyderabad. Now keep in mind, viewers, this is the most important part. It's not just about absolute number of cases or cases going up and down. It's also about the corresponding healthcare infrastructure that we have in these places, because in smaller towns and cities, it's even more difficult. They've not even prepared to that extent. The entire focus in the first half of our battle was actually on the bigger cities. And Dr. Swaminathan, will that be a concern? As we now see outside of the big 4 or 6 metro cities, others continue to show a considerable number of active cases. The fact that we are not COVID ready healthcare infrastructure wise in these parts.
That is a significant problem. Please understand that, like was already pointed out, there is a dearth of very high quality, high end kind of care in many of these areas. So unfortunately, they have to funnel through to some of the major cities for their care. And in fact, what I can tell you is in the majority of hospitals in Chennai, we are all seeing a significant influx of patients coming in very sick from southern Andhra. So in Chennai, our numbers have come down. The majority of occupancy is either from the districts, the adjoining districts of Chennai, and more importantly from southern Andhra, Tirupati, Chittoor, Nellore, Gudur, a lot of those areas where the numbers are pretty high. And it is a significant issue that these numbers are going to remain unrecorded in the Andhra numbers, including the deaths, which may cause them to underestimate the burden that they are actually having. So I think we shouldn't be too celebratory in the numbers that we see, because a lot of it is very confused. And unfortunately, since data sharing is not really systematic, a lot of the data is fragmented and all over the place. So this data is what it is. It's the best we have, but by no means complete.
To your mind, Dr. Swaminathan, how far along or how far away are we from seeing a peak in our cases? I mean, obviously, it's a very difficult thing to project. There are various models around, but like you said, data may not be credible from every single part of our country. So how do we judge where we stand in our war against corona?
I think we should rely less on Western models, whether it is the Johns Hopkins model or the Boston Consulting Group or Harvard or whatever it is, because their numbers have consistently been inaccurate. They have been varying wildly. Those numbers don't seem to have any association with what we are going through. I would in fact look at our neighbors. Bangladesh as a model, even without lockdown, you know what their numbers are. Pakistan, it could have very easily ended up in civil war. Really, nothing much has happened. Thailand, Cambodia, Laos, Vietnam, all these areas have healthcare which is comparable or even worse off than we are. Their numbers are actually quite minuscule. So there is something happening across this part of the world which has not been properly studied. Is it host factors? Is it viral factors? Or is it a combination? We don't know. And again, remember that it's not because there is a lack of seroprevalence of antibodies to the disease. There is significant amount of exposure, and in spite of it, mortality remains low. So maybe we are getting away quite easy. And if that is so, the best thing to do is to allow it to happen this way in a controlled manner while we hasten the vaccine development. But my suspicion is the vaccine is too far away, and by that time it happens, the importance of vaccine is going to be at best minuscule.
That is true. That is true. And by the time we are able to develop a vaccine, get all the clearances, get it to the manufacturing, get it to the common man, and that's going to be another long process. Get it to the people, after your initial rung of the COVID warriors who will obviously get preference in terms of giving them the vaccine, and really bring it out and roll it out to the rest of the country is going to take a really long time. So we are in this for the long haul, and we cannot start taking things for granted. I just want to quickly also highlight Karnataka. I missed it in the first round of this states from the south because Karnataka was also one of those states that we had highlighted the last time as a problem case where sudden spike in cases in Bengaluru and even in other cities had taken place. Karnataka is actually now hoping, projected to have a peak by end of this month if all goes fine. But if you see again in Karnataka, see their graph of recovery rate versus active rate, and you will see how it's such a roller coaster ride and a constant up and down that happens. So even I would say this, even now we will have to wait and watch. Even if the recovery rate is higher than the active cases rate, let's wait and watch to see where it goes and continue with the surveillance, with the testing, with the social distancing that we are looking at. One important state that everybody is talking about right now is Bihar, a state that didn't have much cases initially, and then the big reverse migration took place. A state with the worst healthcare infrastructure in the entire healthcare index. It's second from the bottom. And that's not a new thing. That's how it's been for the state of Bihar for years and decades now. And a state which is now beginning to see a jump in cases. That will be the important one. Badly hit by floods, preparing for an election to come. Dr. Rakesh Kapoor, if I can come back to you on that. For states like Uttar Pradesh and Bihar, where a lot of people who've traveled from the cities have gone into the interiors and the healthcare infrastructure there isn't so strong. How are they faring and what do they need to watch out for?
See, you have raised a very pertinent question. The states like in healthcare system, if you see, probably we would be better than the Bihar. But as I said, there are so many aspects of taking care of this pandemic of the virus. Health care is an important, which I am not saying. But at this time when the pandemic is going on, the number of cases, active cases are going, mortality rate is particular there, and the migration of the peoples are there because every have to work for their earnings and all that. So definitely the government is taking care of that. As I have said earlier, healthcare is a part of the government. Definitely we need a better healthcare system. There is no doubt about that. And maybe in the post-COVID era when these discussions will come up, and definitely the healthcare system has to be improved and we have to be prepared for other pandemics if God forbids if they come there. What we have to understand, you very rightly said, like if you talk about Lucknow, being in the Lucknow and being the director of one of the prestigious corporate hospitals and previously at SGPGI, if you see lot of patients are being coming from the neighboring districts, even neighboring states I may call off. If you talk about like in Medanta, Gurgaon, 50% patients in the COVID wards are from the neighboring states of Uttar Pradesh and Bihar and Haryana and all that. So the important thing what I have said, data are important. They project what is the disease status, how things are improving. But even if the mortality rate is even 1%, for that family it is 100%. If you talk about the active infection rate, if you talk about the infection rates, it might be going down. But even if one person is there who is infected and if he doesn't take care of, he can again, as he talked about the curve, V-shaped versus U-shaped. Maybe we'll come with the plateau, people relax and they again start moving, not taking care, again the rates will come up. If you see when the Western countries and all that, sometimes there is resurgence of the cases because people are not taking care. So seropositivity we have to check, statistics are important, they all are very important. But as I said in the beginning, all the games of statistics are for planning the things and all other things. People might not understand. The lower income group societies, even in the middle income societies, they may not understand what is this statistics is. So it is very important from the part of the government. Statistics is fine for the planning. for other things. But people have to understand the government, as you very rightly said, you talk about our neighboring Asian countries, Bangladesh and other countries. If you talk about why the incidence is so low, even health structure, as you said, may not be better than the India, few of these countries. So it is very important, you rightly said, we don't have to follow the Job Hopkins protocol. We have to see our individual things. We have to see the countries who have the same living standards what is in our country, and then we have to set the protocols. Only once the people will understand the protocol are set in that particular way in the districts and the healthcare system, we have to see in that particular way. Only then we can take control of the situation. Of course,
Okay.
like in Lucknow, if you talk about the number of cases in the last week, they have gone up.
Okay, fair enough. In fact, Lucknow has been also one of those cities which was doing relatively fine in the first few months, and then suddenly there was, a bit of a spike, a sudden turnaround. Like Dr. Kapoor was mentioning, it's because when people let their guard down, people don't take the rules seriously. That's when COVID then hits you and reaches right to your doorstep. Now, let me just also quickly go through the likely peak, or in some cases the cities may have already peaked, but here are the big cities that we keep talking about. Mumbai, for example, has already seen its peak in June. Doesn't mean that Mumbai can take it easy, doesn't mean that Mumbai should completely start behaving as if everything is back to normal, because we are such a densely populated city and so interconnected with our neighboring towns and satellite cities that one mistake and then we will be back to square one. Bengaluru is projected to peak by the end of this month with active cases about 41,503. Like Mumbai, Thane has also peaked now late last month with active cases about 38,389. Pune, though did see its peak, still hasn't shown that much of an improvement since then. We discussed that in detail. Chennai has already achieved its peak with active cases now about 24,000. Chennai was one city that saw a really tough time in June and May and June, and repeated lockdowns is what then brought things under control for the city of Chennai. Madurai again was a problem point in May, June, even till July, until it peaked mid-July, and now things are slowly improving, very slowly. East Godavari is a new name that popped up on our charts because of the number of cases we saw being registered there for COVID, and it's likely to be in its peak right now, and hopefully things will get better, and hopefully they don't get a further setback because of the flood-like situation that's happened in many parts. Patna is projected to peak around September 7th or around that time, but this is the one I will closely watch out for because Patna is not only just catering to its own people but the entire area around it. There are hardly any COVID hospitals in the state of Bihar, one hospital in 5 districts, and that continues to be a big challenge for them. But where do we go from here on? What should be our key focus in terms of policy? Let me ask that question to Dr. Sanjeev Singh Yadav first, and then Dr. Swaminathan. Dr. Yadav, for our policy makers, we are now, in the end of August. What should be the key focus area?
Madam, the key focus area must be developing the primary and secondary healthcare. There is a lot of activity in the tertiary healthcare. Maximum number of population of India is there in the primary area, where the primary health center basically is not developed. The government must concentrate on spending at least 5 to 7% of the GDP, which is a mandatory thing to see that the healthcare of this country rises. You have COVID has proved that except for Europe, all over the world, the healthcare industry has gone down. There are a lot of fallacies. Simple things have not been done. Sanitation is not maintained in the districts. That is the reason why the cases come up every time and again. Whenever there are rains, you get a lot of waterborne diseases. The healthcare infrastructure in the city, which is the mandatory thing to see that Indian population get rid of this healthcare issues time and again, because from 70 we have not done even 10% of what we are supposed to do. This is the Indian Medical Association angle. When the GDP in the healthcare is risen, ultimately the healthcare of the person becomes very well, and the country will survive much better than what it is supposed to happen right now.
Right. Okay, very quickly, Dr. Swaminathan, Prime Minister says that we need to continue with surveillance, isolation and testing. Should that continue to be our mantra? Is there anything else we should add to that list?
I think we also need to look at safe return to normalcy or a near normalcy, because we need to jumpstart the economy all over again. We can't remain in this state of suspended animation for very long because it's just economically unviable. And we need to figure out how we can slowly open out areas, maybe in phases, and a very sensible approach to that, which combines the principles of public health, epidemiology, and infectious diseases to ensure that we don't unnecessarily put people at risk, but at the same time, we kind of restart the economy. And obviously, we need to have long-term learnings in place as well, which includes investment in education about all these things. See, unless the public are aware that these are threats, I'm sorry, these things will happen again. We are doomed to recreate the mistakes of our past if we don't study our history. It's because we never learned about the 1918 flu pandemic that we have allowed this pandemic to sweep across the world, because we never invested in this. So let's take a page out of history and let's learn from this so that we don't make this mistake all over again.
All right. On that note, thank you so much to all of our panelists who've joined us on this conversation. Viewers, data does show an encouraging picture. It does look like if we continue with this in this manner, with this kind of discipline, following the rules, then maybe the turnaround is right here. And maybe by first week of September, the big states and the entire country's national figure sees a peak in its cases. And after that, it will be a smooth road to recovery. But at no point, viewers, can we let our guard down. Yes, jump-starting our economy is extremely important. Figuring out ways to go about our lives without exposing ourselves to the infection or being a participant in spreading the infection is also extremely important. But let's not forget, COVID's not going away anytime soon. And that thought should also always be on our minds. So if we are careful, not paranoid, simply careful. Thank you so much for joining us on this conversation.